Welcome back. Over the past few weeks, we've talked about Medicaid reform proposals, debated that 880 billion budget headline, and broken down the restructuring happening at HHS. Today, we're connecting all the dots and exploring how these shifts in structure and spending could shape the future of federal healthcare policy. Let's get into it. In past updates, we highlighted how federal budget pressure, especially efforts to preserve recent tax cuts, has brought renewed scrutiny to programs like Medicaid and Medicare. Congress is exploring a range of proposals, things like capping how much is spent per person, requiring more people to work to qualify, adjusting who's eligible for expansion, and changing how provider taxes are used to draw federal funds. Now, enter another layer, last week's leaked OMB memo, often called a passback, and this time called, you guessed it, a passback. That memo outlines clear and significant spending cuts. It introduces the new Administration for Healthy America to consolidate many services under one roof. The memo specifies program eliminations that include 14 primary care programs, 10 maternal and child health programs, 15 mental health programs, 10 environmental health programs, 2 HIV/AIDS programs, and 16 health workforce programs. It calls for considerable budget reductions to the CDC, the NIH, and the Indian Health Service, which is resulting in considerable pushback, including a statement by the CEO of the National Council of Urban Indian Health calling on Secretary Kennedy to honor his commitment to prioritizing Indian country. The new agency will have a $500 million research fund tied directly to the administration's Make America Healthy Again initiative. While the proposal talks about efficiency, these changes point to something much larger, which is a realignment of national healthcare priorities. So here's where continuity matters. As you all know by now, HHS laid off about 10,000 people, with a few positions having been reinstated. But the restructuring is going full steam ahead, with a 20,000 person workforce reduction and consolidation of 28 divisions down to 15. It's also centralizing how we manage core benefits. Medicaid, Medicare, CHIP, and ACA subsidies will now be handled under a single health financing division. If implemented well, that kind of structure allows for faster, more unified changes, no matter what direction policy takes. And when you put that together with the cuts outlined in the memo, it's clear this is about more than just efficiency. It's about creating the ability to shift policy direction quickly. Let's bring in some outside context. The Paragon Institute, a conservative health policy group with considerable influence within the administration, has been advocating for several reforms for years. They've called for tightening how we verify income eligibility, ending automatic re-enrollment and coverage, narrowing open enrollment windows, and increasing the amount people have to pay back if they get subsidies they didn't qualify for. The HHS proposal doesn't directly push these ideas, but it creates the platform that would make them much easier to implement. We're talking about shared data systems, centralized eligibility checks, and streamlined oversight. So, even if the policy isn't decided yet, the tools are being built to move quickly in either direction. Now let's talk about the states, because they're watching all of this very closely. Some states, like Missouri, Oklahoma, and South Dakota, have written Medicaid expansion into their constitutions. As we noted earlier, that means even if federal support is cut, they're required to keep going. And that's where the pressure comes in. Missouri could face a $1.7 billion shortfall next year if the federal match is reduced. Other states are already adapting. Indiana recently announced tighter rules for who qualifies for Medicaid and food assistance. And California, that's a whole other level. Over 1/3 of the state's budget relies on federal dollars, most of that going into Medi-Cal. To cover rising costs of including expanded long-term care and full coverage for low-income adults, regardless of immigration status, California had to borrow $3.44 billion from its general fund, with another $2.8 billion appropriated for the rest of the fiscal year. If federal support shrinks, California's budget strain could grow even faster. Why? Because the federal government's $107.5 billion contribution covers about 60% of Medi-Cal. So, where does that leave us? Right now, nothing in the HHS reorganization or the budget memo has changed Medicaid or Medicare benefits. There are no caps in place, no coverage restrictions yet, but the infrastructure is being built. And once it's in place, changes could move quickly. Think of it this way. The foundation is being poured. Whether that foundation supports expansion, austerity, or something else depends on what policies are layered on top. Either way, the system is being prepped for action. So, if you've been following from the $880 billion funding headline to the reshuffling inside HHS and now to the potential state-by-state fallout, you're seeing just how much structure, spending, and politics are now intertwined, as if that was not always the case. Well, thanks for staying with me. I would very much appreciate your perspectives, be they in the comments or individually. And yes, price transparency is on the way.